The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria here with another issue of The Genuine Article, and today I'm talking to Dr. Sune Petersen, and Dr. Petersen is a cardiologist from Denmark, from the Gentofte Hospital in Denmark, and he's published a very interesting paper in JACC that deals with the important issue of acute myocardial infarction, and particularly the role of field triage in reducing the time for PCI. Tell us, Dr. Petersen, what got you interested in looking at this topic?
Well, we've recognized the importance of getting STEMI patients to quick revascularizations, and consequently, we have implemented field triage in our region, meaning that we transport STEMI patients after triage them by telemedicine. And what we found was that telemedicine or field triage actually reduces treatment delay and, even more important, improves outcome.
So when you say field triage, you're talking about experienced individuals who have the capacity to perform a 12-lead ECG and transmit it to a hospital, which can then prepare to receive the patient.
Highly trained paramedics, and then they are teletransmitted into to senior cardiologists who will do the actual triage.
Right, and in your paper you compared patients treated in this way with patients who just went to a hospital without PCI facilities.
Exactly, yeah. Most of our patients are actually still being admitted, you could say, the conventional way, because some patients are what we call walk-ins. Some patients are maybe at the hospital when they get their infarction. But what we can see was that when we use telemedicine, the patients they had significantly shorter door-to-balloon times and also improved outcomes.
And the outcomes, as I recall, which was an important aspect of your study, were heart outcomes, death of myocardial infarction for a year. Is that right?
That's correct, yeah.
What was the reduction in events?
Well, the relative risk reduction, and this was after adjustment for potential confounders, was 33% of getting of dying or having a non-fatal MI.
Yeah, now yours is not the first study that has looked at this. There's been an enormous attention on door-to-balloon time. What do you think your particular study adds to the literature?
Well, it's a rather large sample size. Besides from that, our study data are highly validated. And we can do a lot of adjustment, which is important because most of the knowledge we have has primarily been looking at the independent effect of field triage. We have been looking actually at the independent effect of field triage. And what we could see that field triage, even after adjustment for other confounders, had a positive effect on outcome.
Yeah, 20% reduction in balloon time, 30% plus reduction in events. Very impressive. And what I've taken away from your study is that in trying to get to PCI as quickly as possible in STEMI patients, in trying to reduce the door-to-balloon time, we need to focus more on what happens before the door is reached. If we can implement this field triage, then, in fact, even before the door is reached, we're already prepared to reduce that door-to-balloon time.
I think that's a lot of minutes to gain out there, because when they're at the cath lab, most cath labs or emergency departments at the invasive center, they are quite effective actually. But it's before that time there's a lot of minutes to gain there, and that is what we have shown.
Thanks very much for being with us. It's an important lesson. For The Genuine Article, I'm Tony DeMaria.